Thank you so much for joining us today for the first ever NAMI Wisconsin Growing Together virtual event. I'm Helen Lucy Mills, CIT-CIP Director at NAMI Wisconsin. Although we're not able to gather in person, we're so grateful to have you join us today. Before we get started with our next presentation, let's have a quick icebreaker poll. Here's the question. Would you rather have A, infinite chocolate, or B, infinite coffee? I have a hard time answering this one, actually, especially because I like mocha lattes. Okay, and as soon as tech is ready, we can see the answers. Well, I don't know what the statistical significance is of the answers, but infinite coffee is the clear winner. So thanks for sharing. Now we know a little bit about each other. And now that we've had a little fun, let's get started. At the end of each presentation, we will have a 15-minute Q&A session. You can ask questions throughout the presentation in the Q&A box in your Zoom toolbar. We encourage you to ask many questions to spark conversation. It's my honor to introduce Lauren Hubbard and Colleen Waters and their presentation, Behind the Scenes, Milwaukee County BHD's CART team. And CART stands for Crisis Assessment and Response Team. Lauren Hubbard is an alumna of Prairie View A&M University in Houston, Texas, where she obtained her Bachelor of Science in Nursing in 2011. Lauren has spent her career providing emergency behavioral health care services to the residents of Milwaukee County as a psychiatric RN. Lauren is currently serving as the Director of Community Crisis Services at Milwaukee County's Behavioral Health Division. She oversees various mobile crisis teams, county-based crisis intervention programs, and is leading the community-based redesign of BHD's crisis service. Colleen Waters is a licensed counselor, licensed counseling social worker with the CART team and clinician for the Milwaukee County Behavioral Health Division. Colleen has over 20 years of experience in the social work field. 13 years ago, Colleen transitioned to the adult crisis mobile team in the role of behavioral health emergency service clinician and found a passion for providing crisis intervention. Before joining the crisis service team at BHD, Colleen cared for inmates as CJF, a psychiatric social worker. So I'll now turn it over to Lauren and Colleen.
Oh, sorry, I was muted. Thank you all for having us. It's a pleasure to be able to present this afternoon about our local CART team in Milwaukee County. Next slide. So just to jump right in Milwaukee County in 2013, Milwaukee Police Department and the Milwaukee County Behavioral Health Division decided to join in a partnership to create the first CART team. Again, that's a crisis assessment and response team. The Milwaukee County CART team was mirrored after Houston's Police Department CERT team, which stands for Crisis Intervention Response Team. And just like the Houston CERT team, Milwaukee County's CART team consists of a CIT trained police officer and a master's level licensed mental health clinician that co-respond together to situations within the community. Next slide, please. So for our particular CART team, our law enforcement resources bring certain things to the table that allow us to be able to operate within their system. That is such as dedicated officers, a supervisor as well, access to the dispatch system. For us locally is mainly MPD for one of our teams, where we can be able to not only be dispatched out appropriately, but we can also monitor things that are coming over the system to self-dispatch for appropriate mental health calls. They also provide office space and squad cars and other equipment that it would take for our clinicians to be able to work within the law enforcement world. The collaboration also offers the Behavioral Health Division the opportunity to partner in different teaching and ongoing educational opportunities, such as participating and delivering content for other and ongoing crisis intervention team trainings. Next slide, please. The ability to have a law enforcement officer available on scene, especially in the state of Wisconsin, provides for several things on site. The co-response not only allows for the individual in need to have proper referrals to community-based and outpatient services, it also allows for the evaluation of the need for an emergency detention by a law enforcement officer there in the moment, in the event that safety is a concern and someone may need to be detained for safety and treatment in that moment. Should there be situations in which arrest or booking is not preventable, then again, law enforcement is present on scene at that time. Next slide. So the Behavioral Health Division side of this partnership offers access to our system of care along with specialty trained mental health professionals. We provide dedicated clinicians and a supervisor for the program. We also offer the opportunity to have communication with BHD's Milwaukee County Crisis Line, which also has a dispatch capability to send out additional services or to collaborate amongst the teams. We offer access to our electronic medical record in which these encounters are documented amongst the other encounters across our system of behavioral health care. And we also offer the contribution of analyzing this data to support the outcomes of this program. BHD is a large agency in Milwaukee County, and it has different agencies that provide services not only in the community, but also in crisis and for an inpatient hospital at this time. Next slide. This slide just shows several of the other services that crisis services entails. The CART team is one of these services, in which I'll talk a little bit about each of them. But the great thing about BHD and this partnership is that we also bring access to community-based services for individuals that law enforcement may be responding to in the community to help divert them and to get them access to ongoing treatment. Some of these services, again, include access to our psychiatric emergency room, our inpatient services. We have outpatient services such as community support programs, target case management, and CCS. Within the crisis network, again, we have our crisis mobile team that mans a 24/7 crisis line. CART, the community consultation team, is a specialty mobile team that serves individuals with intellectual disabilities on a mobile basis. We also have a geriatric nurse who specializes in individuals in the geriatric population in a mobile capacity. There's a specialty children's mobile crisis team that can help support and do appropriate follow-up into our children's services and locally in Milwaukee. Crisis care coordination class, which is our certified peer services support system within the community. And we have a couple different options for residential-based crisis services. So the CART team is able to make referrals within their own service program that can be quickly picked up in a warm handoff by other crisis services, that can assist that person in their moment of need. Next slide. Objectives for CART. This is a valuable resource to the community. It provides expert consultation to the officers in the community that are responding to people experiencing behavioral health crises. CART helps to address the needs of people in the Milwaukee area who have been historically brought to our psych emergency room with law enforcement. They also help to impact the number of individuals that may need emergency detention by having a trained mental health professional on site with law enforcement. CART also offers the opportunity for more voluntary interventions to be able to help individuals to make decisions that are in the best interest of their own care. We also provide assistance to accessing outpatient resources in the community. Next slide. So this slide is a visual about a model that shows different ways in which CART in our area have been able to impact the community. The Sequential Intercept model, it shows how individuals with mental health and substance use needs come into contact with and move throughout the criminal justice system often. So again, this co-responder model with having a mental health professional with a dedicated CIT trained law enforcement officer provides us the opportunity within our community to find places where we can be impactful. CART helps this model by filling in a few of the gaps and providing resources as some at some key times along this model, particularly for intercepts 0, 1, and 2, where CART has the capacity to interact with the local crisis care service to also intercept and receive diversion calls from local law enforcement. And through one of our programs, which Colleen will talk a little bit more about shortly, allow CART the ability to be able to influence opportunities for diversion within the criminal justice system. Next slide.
So I'm going to talk a little bit about at the beginning of CART. The slide is not 100% accurate, but so initially way back in July of 2013, we started with one CART team. It was brand new. Like Lauren said, it was based off of what they were doing in Houston, but there was one team and they were kind of paving the way for where we are today. And then Milwaukee County was selected to participate in the MacArthur Foundation Safety and Justice Challenge. That was in 2015. So in February of 2015, we had an additional team. So we had 2 teams at that point. They were selected, one of 20 jurisdictions were selected. The goal was to safely reduce the jail populations and provide additional opportunities and financial support for service expansion, and also to increase the emphasis on data tracking and outcomes. So a big thing that was going on then is we kept a lot of numbers. So they wanted to see, because it was the grant, they wanted to see how many people CART were seeing and what the outcome was. The goal was, like it says, to reduce the jail population, also to increase the voluntary treatment options. So some people were ending up in jail because they weren't cooperating, or they were ending up on Chapter 51 holds. And the goal of CART was to decrease that and have more voluntary. Keeping in mind that when we look at numbers, which we will in a few slides, is when you look at the entire city of Milwaukee. So in 2013, there was one CART team in the entire city. So you think about 7 districts, all that covers, and there was one CART team, then 2 in 2015, and then in 2017, we moved up to 3 teams, which is where we are right now. MPD has 3 designated officers, 3 CART teams, but again, that's the entire city of Milwaukee. So it's not a lot of people for that large of a population. Okay, next slide, please. So we did have an additional team, which unfortunately is no longer in service. BHD had partnered with Milwaukee County District Attorney's Office, and they had a CART team, again, through the MacArthur grant funding that started in November of 2017. It started in West Allis and slowly went to all the municipalities throughout Milwaukee County. But it was only one team that was able to go through the entire county. So thinking about, West Allis is where we started. We did South Milwaukee, West, and we ended up down in Cudahy, all the different districts, or all the different municipalities. But in, I believe it was March or April of 19, that funding ended. So that team, unfortunately, is no longer in service. Fortunately, what came out of that, I believe, was the BHD partnership with the West Allis Police Department. So BHD provided funding to support recruitment of an officer. So they started by paying the West Allis police officer, and they were joined also with a master's level clinician, and that started in April of 2018, and that still is in service. So they only respond to calls in the city of West Allis. They additionally started a youth expansion pilot. So unlike MPD, we do not see anyone under the age of 18 at this point. The West Allis team is able to see people in West Allis under the age of 18. Okay, next slide. So expected outcomes. So the goals, these are some of the main goals of the CART team. It responds as a resource squad to high priority crisis calls involving persons with mental illness or those who are suicidal. A big part of our role versus the crisis mobile team is we can respond to higher acuity crisis calls due to the fact that we're with an officer and we can have additional officers easily meet us there. The goal is it decreases the possibility of use of force and injuries to officers, consumers, and the community. So obviously the last thing anyone wants is for anyone to get hurt. So the goal is to decrease any hands-on, any injuries to anybody. Decreases the volume of involuntary emergency detentions in Milwaukee County. So again, goal is to get people to go voluntarily. Everyone knows that voluntary is in everyone's best interest if that's a possibility. Provides behavioral health assessments and criminal justice facility clearance for individuals taken into custody. So if there are no options other than the individual going to jail, the CART team can do what we call a CJF, or criminal justice facility clearance. We assess the person, we fill out a form, that form goes with them to downtown to the jail, and then the social workers who are going to take over for that person have the information that we've provided, and they can get them safely to a specific pod, or if they need to be on suicide watch, they need to be referred for medications, they need to see a social worker down there, whatever they need at the jail, we can facilitate that. Attempts to decrease the number of repeated interactions between individuals diagnosed with serious and persistent mental illness and law enforcement. So the goal is, if sometimes people are calling the police over and over and over and over, it can be a mental health issue rather than a criminal issue or a police issue. So the CART team can become more involved and get them the referrals they need. So hopefully that those calls to law enforcement decrease. Okay, next slide. So some of the numbers. This slide is going to list 2017, and then I'm just going to glance over. I do have some additional numbers from years to follow. So in 2017, which was when we had 3 squads at that point, the total number of CART contacts was 1,190. So just to reference, so that was 17. The year to date in 2019 was 1,995. So it was over 800 more contacts we had. Part of that, I think, is just getting our name out there, people being more aware of CART, people contacting us more. Just as any new program gets up and running, it clearly is, we have almost twice the numbers that we did in 2017. And additionally, in 2019, we were down 1 officer for 6 months, I think, until that position was filled. So our referring sources, we can get calls from dispatch, can request us, the officer on the scene. So if a squad's dispatched and they're not sure what to do, they'll often call us, the crisis mobile team. And we also do a lot of what we call self-dispatch. What that means is we see a call, we think we could be of service, and we send ourselves and go talk to the person. Referring police district or municipality, again, there's 7 different districts in the city of Milwaukee. And so we keep statistics too on how many from each district contacts us. Total number of face-to-face mobile assessments, 600. So that's how many people we saw face-to-face versus we also do professional consults. Somebody calls us and a squad calls us and just has questions for us. Number stabilized on scene, that was 284. That means stabilized on scene means they didn't go anywhere. They didn't have to go involuntarily. They didn't go voluntarily. The likelihood is we just referred them to somebody in the community to follow up, whether that was their case manager or put in a referral for crisis case management or therapy or whatever it was. Or us, we often too will call people 2-3 days after the crisis and talk to them and see how they're doing. Number voluntarily transported to PCS, 20. Voluntarily transported to private psychiatric hospitals, 59. That's another big thing that we've been doing. I think the old school way, everyone went out to PCS. If the police were involved, they seemed to take everybody to PCS. And so we're trying really hard now. More and more people are going to private hospitals. If they have insurance, they can go to any of the private hospitals and we will transport them there. Number in need of medical clearance, 67. Emergency detention, 63. So out of those 600, only 63 were placed on a hold. And I'm just going to peek really quick. So in 2019, it was the same number about, but we had twice as many calls. So the number of emergency detentions are continuing to decrease. Medical clearance means they had to have some type of, there was some medical concern, whether it was high blood pressure or diabetes, something like that. They had to be cleared before they went to a different hospital. And the CJF clearance I talked about was 107. Okay, next slide. So this is just kind of a graph of that. So as you can see, almost half the people of the face-to-face where we were out talking to somebody stayed at their residence or their group home or wherever they were. The emergency detention is a very small piece of the pie of what we're doing with people and where they're going. So it's pretty clear when you look at that. Next slide. This is just addressing the racial ethnic disparities in diversion efforts. So you can see the number of individuals we saw that were white, about 42%, Black African-American 56.5, and then pretty small amount for the remainder. Next slide, please. So this service is currently available 7 days a week in Milwaukee. Keeping in mind we have 3 teams, so there's only 1 team on the weekend. So the officer rotates every 3rd weekend. So on Saturday and Sunday, the CART team is available. If it's our first shift officer, we're available 8 to 4. If it's our either of the other 2, it's 11 a.m. to 7 p.m. The Monday through Friday shifts that we have are, we have 1 squad working 8 a.m. to 4 p.m. We have an 11 a.m. to 7 p.m. and then we have a 4 p.m. to midnight. And we are obviously practicing the universal precautions and screening for COVID to make sure everyone remains safe. Next slide, please. And then I talked briefly about this. The West Dallas CART began a pilot expansion to serve youth, so 17 and under, in late 2018. They're working with the wraparound program to ensure youth are linked to appropriate community-based services. There's some discussion of MPD, but with only having 3 squads, I think some of that is just numbers. We haven't moved to under 18 yet, and I know there's talk of it. I'm not sure when that's going to happen though. And then in 2019, I had said, so the MPD version was, or MPD contacts was 1,995, and then the remainder of those calls, the 825, was in West Dallas. So West Dallas only has 1 squad and is obviously a smaller city, so their numbers are a little lower, but so between West Dallas and MPD, we saw almost 3,000 people or had contact with, whether that was on the phone or in person. They're also talking about, I'm sure people have read in the news, in 2020 or 2021, CART is collaborating with the Milwaukee County Sheriff's Office to have 2-3 teams working with the Sheriff's Department. So similar concept, just we'd have the city of Milwaukee, then we'd have Milwaukee County, which MPD cannot leave the city of Milwaukee. So if the sheriffs are involved, they can go anywhere in Milwaukee County. Next slide, please. So that's all I have. If you guys have, I know there was a question and answer time. If people have questions.
Yes. Thank you, Colleen and Lauren, for this presentation. It's been very informative and great to learn more about CART. We have some questions. What ages does TRT service? And I'm not sure if it's TRT or CART. And this is
Yeah, I can take that one. So TRT is the Trauma Response Team, and it is a specialty service of the Children's Mobile Crisis Service. TRT also operates locally with the Office of Violence Prevention in the city of Milwaukee, and they respond to youth, children and adolescents who have been present at a scene where law enforcement has been involved at this time. They're receiving referrals. for individuals. Like, so if a child is at a home where some officers maybe come to make an arrest, or maybe there's a violent arrest, domestic abuse, or abuse to that child, or anything that could be seen as a traumatic event while law enforcement is present, they have the ability to make referrals to TRT, or the Trauma Resource Team, and they are serving adolescents and children at this time. The wraparound network does go up to age 23, so it's dependent upon the individual if the youth is over the age of 18, but they do service youth and adolescents.
Thank you. Had to do a quick computer change. So someone who is can you hear me okay?
It's echoing a bit.
It's my computer. Ellie, can you see the questions? Can you pick up? Ellie. Sorry, we're experiencing difficulties. What is that? Okay. Is it joining? Can you hear me? No. Can you ask Ellie to just do the key? Is that better? Okay. Thank you all so much. Let's try this again. Can you hear me? Colleen? Yes. Okay. Thank you so much for your patience with our technical difficulties. It is some of the quirks that come along with COVID and our first virtual event. So someone who is a former police officer who, now I've lost the question, I apologize. I'm going to come back to that question and continue on to the next one. If you had more funding, do you believe you could expand this program? Would you have enough officers interested in participating?
I definitely believe we would. And I think when you look at, so we have access to all the calls in the city of Milwaukee the entire time we're working, and the number of mental health calls that come over the board that we just, especially so from, if we're working 8 to 4, the next team doesn't come in till 11. There's just a lot of calls that we just can't handle just due to low staffing and a small program. But every time they post for an officer, there's enough interest that we could definitely expand.
And actually, as a follow-up question, how are officers selected?
They just, they post it internally. So all MPD officers would have access to, there's a listing for a CART officer, and then they'd apply to transfer from wherever they were. And then they do an interview process. In that, it consists of someone from MPD or multiple people from MPD, as well as 1 or 2 people from BHG. So both sides are interviewing the officers that are applying for the position.
Great, thank you. And I found the question from the person. I'm sorry, go ahead, Lauren. Okay.
I just wanted to add, administratively, funding is always a challenge and a barrier. If the first 2, actually all the partnerships, the Behavioral Health Division did fund the officers for the first 2 years of each of those partnerships, and would be the same for our Sheriff's Department. And so it really is upon that partnering agency to be able to see the buy-in, see the outcomes, and be able to figure out if that's something that they can finance as well, just to answer that person's question. And from a behavioral health division standpoint, and it's heavy tax levy dollars that we are spending for this commitment to be able to show positive outcomes in the public response.
Mm-hmm. Thank you.
Thank you for letting me add that.
Yeah, no, and I agree. We've heard from other programs that having the budget sort of be considered through the county and through the city versus just grant funding provides a lot longer support and buy-in into the program. So I found the question from the former officer in northern Wisconsin who's dealt with crisis intervention and thinks this is an amazing resource and wishes that he'd had it as an option. And his question is, have you seen, since institution of CART, a decrease in physical interventions or recurring events with the same individuals?
I do think that the number, I mean, I don't have statistics on it, honestly, but I know that being on this team for 5.5, almost 6 years, the use of force that we have, I think there's probably been 2 that I can recall when I was working. There was some use of force with somebody. I think that having a social worker, having the background, having someone to be able to talk to them in a safer space where a lot of those high acuity calls typically would not have included a social worker. So it may be more likely that there's some type of physical intervention. But I can go talk to them now in a situation I wouldn't safely been able to before. So, and I think that it definitely has decreased. But again, I don't have any specific statistics on it.
Mm-hmm. Someone asked, what was the year that the CART program started in, and how did it start?
It started in 2013. There was one MPD officer, one social worker, and I know they did a lot of the research and kind of day by day how this program was going to start to evolve. Honestly, I don't have the answer of who started it funding wise. I do know, like Lauren said, that the MPD officer was, that was money that was funded by the Behavioral Health Division. So that officer and the social worker was funded by Behavioral Health Division. But I don't know who came up with the program to start moving it. Maybe Lauren has that answer.
I think it was one of those right times where it was a benefit for both parties, between law enforcement seeing an increase in emergency detentions, recognizing that there was a slight deficit in the ability to be able to respond to some behavioral health calls in an appropriate manner, just thinking public response wise. And at the same time, the Behavioral Health Division looking for an opportunity to impact in a crucial way some of these areas where we could help provide access to services to individuals who may not traditionally have had them in the city of Milwaukee, especially.
Mm-hmm. Another question, and Lauren, you have a nursing background. How can CART be utilized by nurses to provide more information to patients?
So I think that across the board for all mental health or medical healthcare providers, CART is a community-based resource to have someone on scene that can help not only to stabilize situations where people may not have the ability to stabilize themselves, but also to get community-based connections. So CART has a great ability not only to refer people to local community-based resources, but also to tap into the Milwaukee County network for other things that we may have to offer. So it would definitely be individualized depending on that person's needs, but we do have services not only internally at BHD through our law enforcement partners, but other community-based resources, depending on what the nurse and the client, what their needs are. There's also the ability, like Colleen mentioned earlier, to be able to call and do consultation if you can gain access to CART, depending on the situation, what's going on. Mm-hmm. Colleen, is there anything more you want to add?
I don't think so.
When you're working with CART and CART contacts, are you working with new police officers being brought in, or are you leveraging existing police officers?
No, is in regards to the CART team itself?
I think how, I think I would interpret the question in terms of, because we know how they're hired in terms of experience and the interview process. I guess incoming law enforcement officers, how do they become engaged with the CART program?
Well, I guess it's the same. We have the same, we have the same officers all the time. So the person who works 8 to 4 is the same officer every single time. Full-time 8 to 4, full-time 11 to 7, and full-time 4 to midnight. And those 3 officers are CART. They're the MPD CART team. We don't bring new officers in unless somebody leaves a position. And then once someone transfers out for whatever reason, then they go through the process that I talked about earlier, where they post a position, they bring them in, they look for someone who is CIT trained, who has some type of mental health experience background, and select the person from there. They do go through, once an MPD officer is hired or transferred to the CART team, they do go through a 2 to 3 week training process. They go out to BHD. They spend some time in PCS. They spend time with the mobile team. They also spend time with the CART team without actually being what we call in service or working, just to kind of get 2-3 weeks in before they're on their own. If that answers the question.
Yeah, and on the flip side, how are practitioners trained to engage in the partnership with law enforcement?
It has been a lot of internal people going from like I was on the crisis mobile team for 10 years or something like that. And so I transitioned, there was a position open on the CART team, and I transitioned from the crisis mobile team. The first person who started in 2013 came from the crisis mobile team. All but 2 people, I think, came from the crisis mobile team who have worked on CART. And otherwise, it's just a position that's posted like every other position at Milwaukee County Mental Health or BHD. They post a position, someone applies. It can be internal or external. But a lot of people have come from the crisis mobile team. It's just a really good background to have that experience before coming over to CART.
Would you see the CART model as a standard or universal approach to law enforcement and law enforcement agencies?
I think it should be. I think that the more teams that we can have involved, it's interesting because the city of Milwaukee, the fact that law enforcement writes those involuntary mental health holds is actually fairly unusual. So a lot of times it is a licensed mental health professional. So to have the 2 together, I think should be a standard. I think it's been a great addition.
And I would just add to that, every area has its own different needs. And so even as we look in Milwaukee County at a crisis redesign, how our efforts can be brought forward and continue to be responsive to what the community needs now. That could be lots of different variations on what co-responders look like. I'm learning, and it all just has to be fit and tailored to kind of where it is you're trying to intervene and who needs to be at the table to have that conversation. But it definitely is a holistic way to look at response to people with chronic and persistent mental illness in the community, or people who are just having a really crappy day and could use some support and some ongoing assistance.
And Lauren, as you've worked to redesign and are leveraging new opportunities, what stakeholders have you identified?
So at this time, again, we hold partnerships with Milwaukee Police Department in the city of Milwaukee, the city of West Dallas, and to come by the end of this year, a partnership with the Milwaukee County Sheriff's Office. I think that the Sheriff's Department collaboration will give us the right people at the table to continue to talk about what an integrated response looks like. Potentially looking at ways we can work with the Office of Emergency Management, who's being dispatched initially versus CART sometimes coming in on the back end. There are also other things that I've listened to and just having conversations with local emergency rooms, obviously our crisis service at Behavioral Health Division. So all of the people in the community who are most likely serving the same clients need to be at the table to talk about ways that we can all intervene in our specialty areas and work together in that system of care.
Thank you, Lauren. And thank you both, Lauren and Colleen, for your presentations and for taking the time to share your knowledge with us at NAMI, Wisconsin and our community. So thank you so much for joining us. Now we're going to be drawing a name of, and the winner of our awesome raffle basket. If you can pull up the wheel of names, then we can announce who the winner is. And the winner is Elizabeth. That's exciting. So Elizabeth, congratulations. You've won a Dragonfly Yoga gift basket. So we'll send you an email regarding your prize. At this point, please take a moment to answer a few short evaluations questions that will pop up at the end of the webinar. We hope that you'll join us for our other presentation today. And also during your breaks today, please view our Peer Leadership Council video. It's located on the schedule page of the virtual event website. You can meet our members and learn more about what our Peer Leadership Council does. Be sure to check our NAMI Wisconsin membership, which is located on our event page. And if you're not a NAMI member, please consider becoming a member by donating to help us continue to make a difference in the state of Wisconsin and for those affected by mental illness. Also, please follow us on our social media platforms, Facebook, Twitter, and our website, and stay tuned and informed on upcoming events, information about mental illness. Thank you so much and have a wonderful day.